1 in 2 men over the age of 40 will experience some degree of erectile difficulty at some point in their lives. Yet, despite how common it is, very few men feel comfortable bringing it up with their doctor. Many turn instead to internet forums, quick fix supplements, or myths passed from friend to friend. The result: a cycle of frustration, shame, and confusion. Now, let us break through in that noise. Today, we are going to talk about something that is rarely discussed openly: how very specific pressure points in the body can help boost morning erections, especially for men over 60. This is not magic, and it is not a gimmick. It is physiology grounded in the way blood vessels, nerves, and muscles interact in the pelvis. Morning erections, or what doctors call nocturnal penile tumens, are more than just a sign of virility. They are a marker of vascular health, nerve function, and hormonal balance. When they start to diminish, men often worry. Does this mean I am unhealthy? Does this mean my testosterone is gone? Does this mean I will never get it back? The truth is far more nuanced. Research shows that these changes are common, but they can often be improved with the right strategies. Strategies that are based in why men over 50 struggle with energy and testosterone. Science and the lived experiences of thousands of men. Think of your pelvic region like a highway system. The arteries deliver blood like cars racing into the city. The veins are the exit ramps, and the muscles around them act like gates that open and close at just the right times. If those gates are weak, stiff, or uncoordinated, traffic slows down, erections become less reliable. But just as physical therapy can retrain a knee after surgery, targeted stimulation of certain pressure points can retrain the pelvic floor, the blood vessels, and even the nerves that govern erections. Here is the problem. Most men have never been told this. They have been told to take a pill, or worse, to simply accept decline as inevitable. But decline is not inevitable. The body is capable of adaptation even after 60. And today I am going to walk you through 3 pressure points that urologists, pelvic floor specialists, and researchers are beginning to appreciate as powerful tools for erectile health. Along the way, we will bust myths, draw on studies from institutions like the Mayo Clinic and the National Institutes of Health, and give you simple, actionable steps you can start exploring right away. By the end of this talk, you will not only understand what these pressure points are, but also why they work and how you can use them as part of a broader, healthier approach to sexual vitality. So, if you have ever wondered whether there is something more natural, more rooted in your own body's design to help restore stronger, more consistent morning erections, you are in the right place. And I want to reassure you from the start, what you are experiencing is common. It is treatable, and you deserve clarity, not fear. When most men think about erections, they think about testosterone, blood flow, or maybe even nerves, but very few think about muscles. And yet, the pelvic floor muscles are at the very center of constant erectile function. They act like a hidden support system, stabilizing the base of the penis, compressing veins to keep blood trapped inside, and helping maintain rigidity. Let me explain this with an analogy. Imagine you are trying to inflate a balloon. You can blow as much air as you want into it, but if the neck of the balloon is loose, the air just leaks back out. Erections work in a similar way. Blood flows in, but if the venous outflow is not controlled, the discovered erection is weak or short-lived. The pelvic floor muscles, particularly the bulb cavernosus and ischiocavernosus muscles, are the clamps that hold that blood in place. Now, here's what the research shows. A landmark study published in BJU International in 2005 looked at men with erectile dysfunction and found that targeted pelvic floor exercises significantly improved rigidity and maintenance of erections. In fact, pelvic floor training was more effective than lifestyle advice alone. and in some men, it restored erectile function to near normal. This is not theory. This is data replicated in further studies and now widely accepted in urology. The pressure point here is simple but powerful. By learning to consciously activate and strengthen the pelvic floor, you can restore that clamp. The science behind pressure points, the mechanism, and support better blood trapping in the penis. This is why some urologists now recommend pelvic floor training alongside medications or even before medications are tried. So, how does a man over 60 put this into practice? One way is to start identifying the muscles involved. The easiest method is to try stopping your urine stream midway. That contraction you feel deep inside, almost like lifting the base of your pelvis, that is your pelvic floor. Once you can isolate it, you can practice contracting it for 5 seconds, then releasing for 5 seconds, and repeating this cycle 10 to 15 times. Over time, just like training a bicep in the gym, those muscles grow stronger and more coordinated. Think of this like upgrading the foundation of your house. If the foundation is weak, the entire structure above it is unstable. But if the foundation is reinforced, everything else works better. Erections become stronger, morning rigidity returns more often, and even bladder control improves, which is another added benefit many men notice. And if you are wondering whether it is too late to start, the answer is no. Studies have included men well into their 70 seconds with measurable improvements after just 12 weeks of consistent training. This is why the pelvic floor is our first and most important pressure point. It is not glamorous. It is not complicated, but it is deeply effective, and it is something you can start working on today. The second pressure point I want to highlight is one that many men overlook: the perineum. This is the area of tissue and muscle located between the scrotum and the anus. For many men, it is just a stretch of skin they never think about. But for urologists and pelvic health specialists, it is a fascinating hub where blood vessels, nerves, and muscles intersect. Think of the perineum as a crossroads. Running through this region are the branches of the pudendal nerve, which carry signals essential for sexual arousal and erection. At the same time, the perineum overlays key muscles, including the bulbocavernosus and external anal sphincter, that help control blood flow to and from the penis. When pressure is applied here, whether through gentle massage, stretching, or specific exercises, it stimulates those nerves and muscles in a way that can enhance circulation and erection quality. Here's what the research shows. A study published in European Neurology explored how mechanical stimulation of the perineum could improve erectile rigidity in men with vascular insufficiency. The mechanism is thought to involve both direct muscle activation and a reflex. Pressure point has shown for vitality. Loop through the sacral nerves, which amplifies blood inflow into the erectile tissues. Another line of research has examined how prostate massage, which indirectly applies pressure to the same region, can improve pelvic circulation and even erectile function. If that feels abstract, let us make it practical. Many men discover this pressure point by accident. For example, when sitting on a firm bicycle seat, they notice that applying pressure in that area sometimes changes penile sensation. In clinical practice, we refine that principle into something safer and more intentional. Brief, gentle perineal massage with the fingers or with a soft massage ball. The goal is not force, but awareness to awaken those nerves, to bring fresh blood flow, and to reinforce the pelvic floor's ability to deasides, trap blood. This is not about pressing harder to get an effect. In fact, too much pressure can compress blood vessels in the wrong way. Instead, think of it like tuning a musical instrument. Light, consistent pressure stimulates the system and brings it into harmony. Some men combine this with breathing exercises or pelvic floor contractions, creating a coordinated approach that targets multiple layers at once. The perineum is also significant because it gives men a new way to interact with their pelvic health instead of feeling disconnected or powerless. Learning how to engage with this region builds confidence and control. For men over 60, this can be incredibly empowering. It is not about chasing youth, but about working intelligently with the body you have. And here's a simple daily tip. Next time you are seated comfortably, try applying very gentle pressure to the perineum for 30 seconds while performing a slow pelvic floor contraction. Notice the sensation, then the release. Over time, this can condition the muscles and nerves to respond more efficiently, reinforcing the very pathways that support stronger morning erections. If this is helping clarify things, give it a thumbs up and keep learning, because every step of this journey is about removing shame, restoring control, and reminding you that your body is capable of more than you might think. The third pressure point we need to explore is the base of the penis itself. This is not only where blood enters, but also where much of the penis blood trapping mechanism is anchored. If you think of the penis as a balloon, the base is the nozzle, the point that determines how well the air, or in this case, blood, stays inside. At the base of the penis sit structures that play a critical role in erectile function. The corpora, the two main erectile chambers, extend deep into the pelvic floor like roots of a tree. These roots are wrapped by the ischia cavernosus muscles, which contract to compress veins and trap blood during erection. In addition, nerve bundles that branch from the pudendal nerve converge in this region, carrying both sensory and motor signals that determine rigidity. Here is what the research shows. Studies published in the Journal of Sexual Medicine have demonstrated that targeted stimulation at the penile base, whether through pressure, pelvic floor engagement, or even mechanical devices, can enhance rigidity by improving venal occlusive function, which is the ability of veins to stay closed during erection. In other words, pressure at the base strengthens the very seal that prevents blood from leaking back out. Men often experience this intuitively. For instance, when wearing a constriction ring or when adjusting themselves during intimacy, they notice that holding the base firmly seems to improve firmness. Porology research has essentially confirmed this, but with an important caveat. The goal is not simply constriction, but functional training. By learning how to activate the muscles around the base, men can achieve a similar effect, naturally, without external devices. So, how do you translate this into daily practice? One method is to combine pelvic floor contractions with gentle pressure applied to the base of the down penis. For example, while seated or lying down, place 2 fingers at the base and apply light upward pressure while contracting the pelvic floor. Hold for 5 seconds, then release. Over time, this helps condition both the muscles and the vascular response, in that how it boosts energy and testosterone region. Think of it like training a valve. The more often it is activated correctly, the more reliable it becomes in daily function. For men over 60, this is particularly important because the smooth muscles in the penis may have lost some of their elasticity with age. Supporting them with coordinated muscle pressure and awareness can compensate for that loss. The psychological benefit is also worth noting. Many men over 60 feel disconnected from this part of their body, or they fear that reduced morning erections are a sign of irreversible decline. Learning to engage with the base of the penis to understand its mechanics and practice small daily exercises can restore not just physical response, but also confidence. And that confidence feeds back into the body's natural erection pathways, because arousal and rigidity are never purely mechanical. They are also deeply psychological. So when you think of the base of the penis, think of it as your control center. Strengthen it, engage with it, and you strengthen the entire erection process from the ground up. So far, we have focused on the pelvic floor, the perineum, and the base of the penis, all very direct local pressure points. But the body is never just local. Erections are not only about blood vessels and muscles, they are also about nerves. And some of the most important nerves for erections begin not in the pelvis but in the lower back, specifically the sacral nerves. Nerves that branch out from the spinal cord in the lower back are crucial for erectile function. These include the pudendal nerve and pelvic splanchnic nerves, which carry signals that trigger dilation of penile arteries and contraction of pelvic floor muscles. When these nerves are disrupted, whether by poor posture, chronic lower back pain, or even nerve compression from conditions like spinal stenosis, erections can weaken. Think of your nervous system like a set of electrical wires running through a house. If the wires near the main set around and breaker box are pinched or damaged, the lights in a distant room may flicker. In the same way, a problem in the lower back can manifest as weaker morning erections. Here is what the research shows. A study from the National Institutes of Health has highlighted the link between lumbar spine health and erectile dysfunction, particularly in older men. Patients with nerve impingement in the sacral region reported higher rates of erectile difficulties even when their hormone levels and cardiovascular health were otherwise normal. Another study published in Spine Journal showed that men with chronic lower back pain had nearly double the risk of erectile dysfunction compared to men without back issues. This is why pressure points in the lower back and sacral area matter. Gentle stimulation, stretching, and even massage here can relieve compression and enhance nerve signaling to the pelvis. Urologists sometimes work in collaboration with physiotherapists for exactly this reason, improving posture, spinal mobility, and sacral nerve health can indirectly restore erectile function. So, how do you make this practical? One daily exercise involves lying on your back, bringing your knees toward your chest, and gently rocking side to side. This relieves pressure in the sacral spine and promotes circulation. Another option is to sit on a soft massage ball placed just under the sacrum, allowing your body weight to apply gentle, sustained pressure. This helps release tension around the sacral nerves, improving their signaling. Pressure point #2 for circulation. The capacity. What is powerful here is the sense of connection. Many men think of erectile dysfunction as something isolated to the penis, when in reality it can be a whole body issue. Addressing sacral nerve health reframes erections as part of a larger system, one that responds well to care and conditioning even after 60. And remember, the nerves are not just mechanical pathways. They are also influenced by stress, mood, and sleep. Taking care of your lower back is not only about posture, it is about keeping your entire neurovascular system firing properly. If this resonates with you, let me know in the comments. Conversations like this help normalize the reality that erectile health is complex, multifactorial, and absolutely worth talking about. When most men think about erections, they think about blood flow, hormones, or maybe even nerve signaling. Very few stop to consider something as basic as how they breathe, but your breathing and more specifically how your diaphragm and abdominal pressure systems function plays a surprisingly important role in sexual health and morning erections. Let me just break this down like I would in the clinic. The diaphragm is the large dome-shaped muscle that separates your chest cavity from your abdominal cavity. Every time you inhale, the diaphragm contracts and moves downward, creating negative pressure that draws air into the lungs. At the same time, this movement exerts gentle pressure on your abdominal organs, pelvic floor, and blood vessels. When this system is working smoothly, it helps regulate circulation, reduce stress, and maintain optimal nerve function. Now, imagine the opposite. Many men, especially as they age, fall into a pattern of shallow chest breathing. Instead of engaging the diaphragm fully, they rely on the upper chest and shoulders to move air. This creates tension in the body, reduces oxygen exchange, and most importantly, decreases the rhythmic pressure on the abdomen and pelvis. Over time, this lack of diaphragmatic movement weakens the pelvic floor, limits circulation, and contributes to erectile difficulties. Think of the diaphragm and pelvic floor like two ends of a piston. The diaphragm is at the top. The pelvic floor is at the bottom. As you inhale deeply, the diaphragm pushes downward and the pelvic floor gently yields. As you exhale, the diaphragm rises and the pelvic floor recoils. This constant rhythm creates a pressure pump that improves blood flow through the pelvis, including the arteries that feed the penis. If that pump is weak or dysfunctional, circulation suffers. Here's what the research shows. A paper published in Andrologies highlighted how diaphragmatic breathing improves endothelial function. That is the health of the inner lining of blood vessels. Endothelial function is crucial for erections because nitric oxide, the deschiine molecule that triggers penile arteries to dilate, is produced there. Another study in Frontiers in Physiology showed that slow, deep breathing improved vagal tone, which is a measure of parasympathetic nervous system activity. Why is that important? Because the parasympathetic nervous system is the branch that drives erections. In other words, breathing directly influences the body's ability to shift into the rest and aroused state necessary for sexual benefits for stamina and performance function. And there is another layer here. Stress, anxiety, and poor sleep are all common in men over 60. Each of these states is tied to shallow, rapid breathing. Chronic stress keeps the sympathetic nervous system, the fight or flight branch, switched on. And when that system dominates, erections are suppressed. By training the diaphragm and practicing deep breathing, you are not only improving pelvic circulation, but also shifting your body into a calmer, more erection-friendly state. So, how do you make this practical? Here is one simple daily exercise I recommend to men in my clinic. Lie flat on your back, bend your knees, and place one hand on your chest and the other on your abdomen. As you inhale slowly through your nose, aim to make the hand on your abdomen rise while the hand on your chest remains relatively still. Hold that breath for a brief moment. Then exhale gently through pursed lips, letting the abdomen fall. Repeat this for 5 minutes each morning and evening. Over time, this retrains your diaphragm to move fully, restores the piston effect with the pelvic floor, and promotes better blood flow. Another technique is called box breathing, which is especially helpful for men who struggle with anxiety about erections. Inhale for a count of 4, hold for a count of 4, exhale for a count of 4, and hold again for 4 before the next inhale. This not only conditions diaphragmatic breathing, but also calms the nervous system, making erections more likely to occur naturally. It may surprise you to learn that professional athletes, yoga practitioners, and even military personnel use diaphragmatic breathing to improve performance, resilience, and recovery. The same principle applies here. Controlled breathing optimizes oxygen delivery, reduces vascular resistance, and balances the nervous system for sexual health. Those benefits translate directly into stronger, more consistent morning erections. Let me give you a metaphor. Think of your pelvic circulation as a garden hose. The diaphragm is the hand pump that pushes water through the hose. If you barely move the pump, the flow is weak and inconsistent. But if you pump rhythmically and fully, the water pressure increases and the flow becomes reliable. That is exactly how deep diaphragmatic breathing supports erectile function. And here is a real-world application you can try starting tonight. Before bed, spend 5 to 10 minutes practicing slow belly breathing. As you breathe, focus on relaxing your jaw, your shoulders, and in your abdomen. This routine not only improves pelvic blood flow, but also primes your nervous system for restorative sleep. And remember, restorative sleep is when testosterone peaks and nocturnal erections occur. In other words, breathing is not just a relaxation exercise. It is a way of conditioning your entire erection cycle. The takeaway is simple but profound. Your breath is a pressure point. You do not need a device, a supplement, or even a prescription to start using it. By reconnecting with diaphragmatic breathing, you strengthen your pelvic pump, improve vascular health, and calm the nervous system pathways that make erections possible. For men over 60, pressure point #3 for hormonal balance. This is a low-cost, side effect-free tool that can transform how the body responds. So, if you have ever dismissed breathing as too basic to matter, let me reassure you, it matters more than most people realize. And it is one of the easiest, most powerful ways to support your body's natural capacity for strong, reliable morning erections. We have now looked at the pelvic floor, the perineum, the base of the penis, the sacral nerves, and even the diaphragm. Each of these pressure points plays a unique role, but the real power comes when they are brought together in a simple daily practice. Integration is where science becomes habit and habit becomes results. Let us break this down, like I would with a patient who asks, "Doctor, what should I actually do every day?" The first step is awareness. It is not enough to know that the pelvic floor matters. You must be able to feel it. Many men over 60 have lost some of that connection because the muscles are deconditioned. Start with the basic pelvic floor exercise we discussed. Gently contract the muscles you would use to stop the flow of urine. Hold for 5 seconds, release for 5 seconds, and repeat this 10 times. This takes less than 2 minutes and begins to restore muscle tone. The second step is adding the perineum. Once you can reliably contract the pelvic floor, place gentle pressure on the perineum with a finger or a small softball. As you apply that pressure, perform the same pelvic floor contraction. This combination recruits both the muscular and the neural elements of erection control, amplifying the effect. Think of it like pressing 2 piano keys at once. The harmony is fuller than either note alone. The third step is engaging the base of the penis. While doing pelvic floor contractions, place light upward pressure at the base, hold for 5 seconds, then release. This trains the cavosus muscles to compress the penile veins and helps condition the blood trapping mechanism. If you do this consistently, you are literally practicing the very act of maintaining rigidity, but in a controlled and therapeutic way. Now let us connect this with the sacral nerves. Before you start your pelvic floor and perineal work, spend 1 minute lying on your back, bringing your knees to your chest and gently rocking side to side. This relieves pressure on the sacrum and primes the nerves that send signals into the pelvis. It is a simple, low-effort stretch that keeps the wiring clear before you start exercising the muscles. And finally, bring in the breath throughout every step. Pelvic floor, contraction, perineal pressure, base engagement. Breathe deeply with your diaphragm. Inhale slowly, letting your abdomen rise. Then exhale fully, letting it fall. This coordinates the piston effect we discussed earlier. Send fresh blood into the pelvic region while the muscles hold it there. When done properly, it feels not forced, but natural, as if you are sinking your entire body into one smooth system. Here's what the research shows about combining these strategies. A clinical trial published in Physiotherapy examined men with erectile dysfunction who practiced integrated pelvic floor and breathing exercises. After 12 weeks, over 70% of participants reported significant improvement in erection hardness and frequency of morning erections. Another study in Journal of Sexual Medicine emphasized that multimodal approaches combining nerve, muscle, and vascular conditioning outperformed any single method alone. This confirms what many urologists are seeing in practice. The more integrated the approach, the better the outcomes. To make this realistic, let me outline a short daily routine you can try. Begin with 1 minute of gentle sacral rocking to free the lower back nerves. Move into 10